Welcome to The Explainer. Today, we're going to play medical detective. We've got two really urgent cases where the eyes are basically screaming that something is wrong with the rest of the body. Our job? Let's decode those signals before it's too late.
So think about this for a second. We usually imagine a health crisis as, chest pain, something really obvious. But what if the biggest clues to a life-threatening mystery were hiding in plain sight, right in someone's eyes? The eye is amazing because it's the one place we can actually see our nerves and blood vessels without making a single cut. It's a literal window into our health, and that's exactly what we're going to explore.
All right, our first case file. This one opens with a scenario that is just absolutely terrifying for anybody. A sudden, shocking change where part of your world just goes dark. So let's meet our patient. He's a 60-year-old man and he walks into a clinic. Now, he's not a total mystery. He already has a diagnosis of something called giant cell arteritis. That's a serious deal where your own immune system basically attacks your arteries. But he's here today because something new and something really alarming is happening to his vision. Okay, so here are the clues laid out for us. The vision loss is sudden, it's painless, and it's severe. That's a huge triple red flag right there. When the doctors look in his eye, they see a pale, swollen optic nerve. That's the main cable from the eye to the brain. And maybe most importantly, his blood tests are showing sky-high levels of inflammation. This isn't just an eye problem, folks. This is a system-wide, 5-alarm fire. With all this evidence, the clock is just ticking away. His vision is fading fast, and any damage could become permanent, or even worse, it could happen to his other eye. Every single second matters. So what is the one thing you have to do right this instant to save his sight? And now, the verdict. When you're in a race like this, the answer isn't just about what treatment you give, it's all about the how. We're talking speed and we're talking power.
And here it is, the one critical move. You immediately hit him with high-dose corticosteroids, delivered straight into his bloodstream through an IV. This is the only move. There is zero time to waste with pills or other slower methods. You have to put out that fire, and you have to do it now.
So what is this thing? The diagnosis is arteritic anterior ischemic optic neuropathy, or AAION. I know, it's a mouthful. But just think of it like this. The inflammation from his condition is literally choking the blood supply to the optic nerve. It's a power outage. And here's the really sobering part. The number one goal of treatment right now is to stop that blackout from spreading to his other eye. So the emergency protocol here is crystal clear. Step 1, get those IV steroids in to kill the inflammation. Step 2, protect the other eye because preventing total blindness is the top priority. And only then, after the treatment is started, do you move to Step 3, arrange for a biopsy to officially confirm the diagnosis. The rule is simple. Treat first, confirm second. This chart just breaks it down perfectly. You might ask, well, why not just give him steroid pills? Way too slow. The IV gets a much higher dose into the system way faster. Okay, so why not do the biopsy first to be sure? Because while you're waiting for that procedure, your patient could lose their remaining vision. It's an absolute non-starter. Every other choice just misses how urgent this really is.
All right, time to switch gears to our second mystery. Now we're moving away from a sudden crisis and into a more chronic puzzle. And in this case, the patient's very gaze, their stare, it holds the key to everything.
So our second patient is a 45-year-old woman, and she comes in with this whole list of problems that honestly seem like they have nothing to do with each other. Our job, as detectives, is to find that one single thread that connects all of it.
Let's look at the clues we're working with. First, her eyes. She says they feel gritty, her vision comes and goes, her eyelids seem pulled back, and her eyes look like they're bulging out. That's a big one. It's called proptosis. But at the same time, look at the rest of her body. She's losing weight without trying, she has tremors, and she can feel her heart racing. The trick here is to see the pattern, to connect the eyes to everything else.
So what's the one diagnosis that can possibly tie all of these strange clues together? Let's put these puzzle pieces into place. And there it is. The one thing that connects everything is Graves' disease. It's an autoimmune condition that kicks your thyroid into overdrive. And this single diagnosis explains it all, from her gritty, bulging eyes, all the way to a racing heart and weight loss. The part that specifically affects the eyes is called thyroid eye disease. And you can think of it like this. It's basically a case of mistaken identity. The body's own immune system gets confused and starts attacking the tissues in the muscles behind the eyes.
All that inflammation and swelling then physically pushes the eyeballs forward, and that's what creates that very characteristic stare.
And this really shows you why getting the diagnosis right is so important. Another autoimmune condition, Sjogren's syndrome, can also cause really severe dry eyes. But, and this is the key, it doesn't cause the bulging eyes or the pulled back eyelids, and it certainly doesn't explain the weight loss and tremors. Only Graves' disease fits every single piece of evidence on the board.
So, we've now solved two very different cases. One was an all-out emergency. The other was a chronic mystery that needed connecting the dots. After all this detective work, what's the single most important lesson that we should all take away from this?
The message, really, is so clear and powerful, you have to listen to your eyes. Symptoms in your eyes aren't always just about your eyes. So often, they are the very first, the most visible, and sometimes the most urgent red flags for a hidden disease that's affecting your whole body.
And that just leaves us with a final thought to take with us, doesn't it? Recognizing these kinds of connections, it's not just a skill for doctors, it's a really crucial part of understanding our own health. It makes you wonder, what other silent signals, what other clues from our bodies might we be overlooking right now?